Thank you for joining us for this episode of Comply on the Fly with M3 and Karen B. Comply on the Fly is your trusted weekly resource for reliable insight and quick answers on common employee benefits compliance questions. Please note, this podcast and the contents herein do not constitute legal advice. Seek the advice of counsel for any employee benefits compliance-related guidance or strategy.
Hello, everyone. I'm Karen B. And the Comply on the Fly question of the week is, well, it's not really a question per se, but you may be wondering about the end of the COVID national emergency or public health emergency and how this will affect your group health plans. So here's a little helpful information. On January 30th, 2023, the Executive Office of the President of the United States issued a, quote, statement of administration policy, end quote, declaring the discontinuation to the COVID-19 national emergency and public health emergency effective May 11th, 2023. The end of these emergency periods will have an impact on your employer-sponsored health plans. First of all, during COVID, you may recall that certain deadlines related to your group health plan were extended. Specifically, deadlines were extended for COBRA, and that's relative to the 60-day election period, the premium due dates, and the notification of a qualifying event or determination of disability. Special enrollment, which is that 30-day time period where people can enroll, or 60 days under CHIPRA. The benefit claims procedure deadlines that relate to an appeal for an adverse benefit determination, and also the time frame for a request for an external review or final internal adverse benefit determination. Now, the original guidance that was issued in May of 2020 extended these time periods until the end of the national emergency plus 60 days, which was deemed the outbreak period. Additional guidance issued in 2021 applied an extension of 1 year from the date of the event or until the end of the outbreak period, whichever was first. The scheduled end of the national emergency is now set for May 11th, 2023, which will put an end to these deadline extensions on July 10th of 2023, which is the end of the outbreak period. In addition, COVID testing and vaccines were required under your health plans. For tests, health plans were required to cover COVID-19 tests without applying any cost sharing. Once the public health emergency ends, first dollar coverage of the test will not be required. In addition, during the public health emergency, non-grandfathered plans were required to cover COVID-19 related preventive services, which included vaccines, without imposing cost sharing and without relation to whether a provider was in network or out of network. Once the public health emergency ends, provision of the vaccines can be limited to in-network providers. And that is your Comply on the Fly question of the week. Thanks for tuning in.
What's on your mind? If you have a pressing compliance question, send it to askkarenb@m3ins.com. We'll do our best to cover it in an upcoming episode. You can now follow and subscribe to Comply on the Fly on Spotify, iTunes, and Google Podcasts. Make sure to tune in next week and encourage others to join us.